Hello everybody, I'm Dr. Sushal Shantakumar. I'm a consultant shoulder surgeon in Manipal Hospital's Old Airport Road, Bengaluru. I'm going to tell a few words about shoulder replacement surgery. I think there's a lot of misconception about shoulder replacement saying, since we do not do it routinely, yes, but then of course with so much advances, latest techniques today, I think shoulder replacement is here to stay. So the first misconception is, unlike knee replacements, shoulder replacement are not really much painful. In fact, you can go about your daily activities from day one. You are mobile by the evening of the surgery. So relatively painless. Second misconception, shoulder is not a weight-bearing joint. So the challenge here is to restore function. So one of the newer techniques or the newer implants which we have is known as reverse shoulder replacement. So what is reverse shoulder replacement? So routinely, an anatomical shoulder replacement means where you depend on anatomy. You used to replace the ball with a metal ball and a socket with a poly liner. However, in reverse shoulder replacement, we replace the socket with a ball, a metal ball, and we put a cup with a stem on the ball. So you're reversing the polarity. That's what it's called as reverse shoulder. So why do we do this? We have realized that as the patient gets older, the rotator cuff muscles become thinner and start to function less effectively. So in patients who are old, the rotator cuff does not function as we want to. So the reverse shoulder in our studies has found to be better in restoring the range of motion, giving better pain relief so that the patients can not just be relieved of pain, they can in fact get back to some sort of activity. You can get back to playing golf, you can do your routine activities, you should be able to carry your grandchildren. So this is what reverse shoulder replacement has to benefit, has to offer to the older age group. Also, as we are doing more and more reverse shoulder replacements, we have found this is also an effective surgery in patients who have bad complex fractures. We call it 4-part fractures of the shoulder, especially in the elderly. Previously, we used to fix them with a plate and screws, and we used to wait for about 2 to 3 months before the fracture healed. The advantage of a reverse shoulder is faster rehab. There is no healing to occur because we have replaced the entire joint, and faster recovery and faster range of motion. So these are the advantages of reverse shoulder. Kindly do meet a shoulder surgeon. He'll explain it to you in detail. And of course, if you're a candidate, you will definitely benefit from a reverse shoulder replacement. And unlike total knee replacement, you do not have to be worried about prolonged physiotherapy and painful surgeries.